So we have the pleasure today of hosting Dr. Jason Kasarsky, a very well-known, respected, and quite successful dentist in the New York City area. Dr. Kasarsky is here to share with us some of his experiences in using the PeriActive oral rinse in his practice. So, Dr. Kasarsky, maybe you can give a brief introduction of yourself and your background?
Sure. Hi there. My name is Jason Kasarsky. I'm a private practice clinician here in New York, 595 Madison Avenue. I graduated NYU in 1975 and taught there for a while. I am presently on visiting faculty at Spear Education, Scottsdale, Arizona. Type of practice is a general comprehensive practice focusing on restorative work, prosthetics, cosmetics, and implant restorative dentistry.
Thank you. So how long have you been using PeriActive in your practice at this point?
I've been using PeriActive for 10 years, a solid 10 years.
And would you describe what type of patients you use it for? What type of indication? Is it for gum disease or for additional uses?
We have been using PeriActive in successfully treating gingivitis, periodontitis, cases of recession, various types of gum disease, localized and or entire mouth. We have been using PeriActive during our post-op laser work, dry mouth as well. We have found some nice success with an additive of PeriActive along with the biotin supplements.
Interesting. So what type of benefits have you seen so far, and how would you describe the reaction that your patients have seen clinically to the use of PeriActive that you wouldn't have seen without the PeriActive?
I would say that the benefits that we have seen, on a clinical basis, as well as input from the patients, has been a significant prevention of inflammation, along with a reduction of plaque buildup, reduction of bleeding gums, promoting healing. As I had said, after post-op laser work, after periodontal surgery, and those benefits have been outstanding throughout the entire scope of patient load. I can truthfully say to you that I have yet to find a patient who has said this rinse is not working for me. The best part about this is that I'm eyeballing and seeing clinical results, but this outstanding benefit is having a patient say to me, I'm noticing a difference, and where I have had periodontal surgery, laser surgery, or I was at your office years ago or at another practice where I was on various types of rinses, this seems to be working A, better, and B, in a faster outcome towards success.
Very nice, impressive. Maybe could you share with us one specific case where you felt PeriActive made a vast difference in that patient's care? It's just an interesting anecdote, something along those lines.
Certainly. I'm going to use myself as an example. A number of years ago, I was battling non-Hodgkin's lymphoma. And throughout the course of my chemotherapy and radiation therapy, as we all clinicians know, seeing patients who are undergoing chemo, mouth and oral environment is a very difficult area, A, to keep clean, B, you're dealing with ulcers, bleeding gums, very slow to recuperate because your body is just distraught with trying to get rid of cancer cells. I had the PeriActive rinse in my, at the hospital and at home. So when I was in the hospital, I can using it literally 3 times a day, not twice a day, along with regular hygiene care, best I could from a brushing, flossing situation. I have noticed that the healing of oral sores were rapid. B, it made such a difference that the nurses, as well as the hematologists and oncologists, remarked to me that they had never seen A, the product, and B, had never seen the oral environment hold stable as best as it could. Prior to this, they would hear patients talk about how difficult their mouth was, and it was to keep clean, and it was bothering patients. I felt some discomfort, but there's no question that using the PeriActive made my outcome better orally and was able to maintain better health of my gingival tissue throughout the course of chemotherapy. I have passed that along to various patients, and everyone has said exactly what I'm saying. So there's a very personal insight into an example.
That's a very astounding and very touching story. So thank you for sharing it with us.
My pleasure.
So do you feel that the uses in general dental practice mirror what you were seeing as a protective element in the chemotherapy that you were receiving?
Yes. You're not already being compromised. All right. So there's an added benefit in that. The fact that there's no alcohol, the fact that there's no staining, the fact that it's botanicals has given me a very positive aspect as far as talking to patients, particularly many will say they do not want to be using an alcohol-based product. And actually some of them who have been through alcohol issues and AA and do not want to be using an alcohol-based product because they feel they're endangering their own sanity, so to speak. So across the board, I have not found any issues with patient acceptance. I will tell you that a number of years ago, because I have been on board for 10 years, there was some taste differences that the patients were saying, I'm not 100% fan of the taste, but a number of years ago when the taste changed, everybody's on board. When I started dispensing in the office, one at a time, I can see how the growth of patients' acceptance and patients asking, let me leave with 2 bottles, let me leave with 3 bottles. I'm not going to see you for 3 to 4 months. Number of people we ship to them because they're out of town, and if they're flying in, they don't want to be carrying more than 3 ounces of liquid back to Miami or Great Britain, X, Y, and Z, wherever they're headed. So for me, it's a win-win product.
So there are a lot of mouth rinses on the market and a lot of heavy-duty marketing which goes along with them. What would you say, in your experience, sets PeriActive apart and makes it so unique?
As I had stated a couple sentences ago, I think the huge difference is the botanicals and the alcohol-free and the lack of staining. I know after periodontal surgery, some laser surgery, whether it's with a scalpel or with a laser, routine protocol, many offices or clinicians around the world are using a chlorhexidine product or used to. Staining is a big issue with that. And patients pick up on that. They're told about it. And then when they see that, 2.5, 3 weeks later, their teeth are gray brown, it's not a nice outcome for them. Yes, it polishes off, but it's an added issue. So those three points make it a huge difference. I would also, the lack of alcohol gives it a better taste for me. I don't get a burning taste. And I have heard that from patients who say, when I've been using various other rinses that are alcohol based, they don't like the taste and or the little slight burning sensation that occurs. Yes, they feel it's working, but if you can get there without the alcohol, I think that's a huge, huge benefit.
So would it be a good summary for me to say you're a significant fan of the PeriActive rinse?
I am a very big PeriActive fan, no question.
Dr. Kasarsky, thank you very much for your time, for your explanations, and for your erudition about this topic. So I appreciate it very much. I know you're busy, and thank you.
Absolutely, my pleasure.